人喺美國啦、加拿大啦、夏威夷啦、香港、菲律賓、東南亞國家。咁其實點解會講係 stress 咩？因為壓力咁大就會對糖尿病有關係嘅咩？其實原來好大關係。因為好多人咧，其實咧唔知道咧，原來就壓力咧係令到佢糖上高嘅。咁同埋仲有咧 ，especially 我哋啱啱香港我哋嗰一個咧5萬個冠狀病毒嘅即係大家喺度將嗰啲你傳我傳你啦，哇！好大問題出現喎，原來呢個，因為好多人咧就可以擔心啦。點解擔心咧？第一佢擔心話，哇！嚇到我咧。第二樣嘢咧，好多人咧，如果你要睇醫生，冇得睇，因為 cancel 咗嗰個安，因為冠狀病太高，啲人俾入嚟。好多人咧就可以叫 add up 就 self care， 即係我唔知做乜喎，換手指，我呢個量高喎，但係佢量高揾唔到醫生喎，就係揾自己嘅醫生，醫生唔想見你喎，哇！咁壓力好大，所以其實呢樣嘢咧，即係整體咧我都見到咧，原來好多人就開始話，哇！好即係好擔憂。有壓力 stress， 越整 stress 咧越多咧，嘅個人佢越高。所以今日咧，首先真係要知道點樣去處置啲咁嘅血糖高，因為叫做呢個 stress 嘅壓力同埋 psychological 嘅問題，即係情緒嘅問題咧，會係影響你血糖嘅。哇！呢個係一個好大問題。咁今日嘅講座就係講呢樣嘢咧，所以就會個係好嘅，幫助你了解同埋咧。如果你識控制到嘅話咧，咁你幫呢個整體嘅東西係個壓力降低嘅。嗱，我話俾你聽，呢個係好 serious 嘅。點解咧？我有一個病人咧，即係同係都好傾得埋啦 ，share 咗好多佢自己嘅 emotion 嘅東西俾我啦。哇！原來佢搞到自己咧係會覺得我想自殺，即係我要係同佢講下嘅，唔緊要咧，你即係會有好大問題嘅，得嗰啲咁嘢啦。即係我覺得佢哋真係會好驚喎。真係會即係諗到哇，會自殺。咁所以變咗嚟講咧，就希望大家咧，至了解就要唔好話以為咦係喎，我就即係可以即係係咪會自己會處理到咧？未必係。Okay. So I would like to share with you some of my just recent experience. As I said, some of my patients call me and develop a relationship at night time. Not so worried. Actually, they don't feel like living anymore. And there is a little thought in their mind that say, maybe I should die. And which is really serious. I thought, wow, hey, that's a real serious. You really need some help. So certainly with the guidance, talking, that was much improved afterwards. But on the hand, that's something that you cannot take lightly because that can be dangerous if there's no one to talk to and they can really turn themselves into the wrong place. And wrong place meaning they would kill themselves or suicidal. And wow, that is so bad. So you gotta really know what to do. Stop them from getting worse, and eventually you might end up to be a corner that's not good. So before I start, I would like to share my screen and maybe have a little bit review of this is my slide today. Let's see. Okay, today, so I will take a little time to just talk about diabetes, so everybody catch up with each other. I know there's some new customer listen to our webinar, might not know much about diabetes enough. So we will just go through a review what we do, and then from there we can talk a little bit more, and then we can answer question from the floor. Okay. So 各位朋友，今日咧我講咗之後咧，我9月10日嚟啦，咁我就 spend 大概5至10分鐘嘅時間講咩叫糖尿病啦，咁大家都可以好快速 catch up 嘅。Okay, as you know, diabetic is a chronic disease. You don't get well, all you can do is control. Okay, that is very known. Now, a lot of people don't realize this. Say, can I really get well after I do this, take medication? Not really, because diabetic, you cannot get well, and you gotta control all the blood vessels not being plugged up by the cholesterol and sugar. They will form plaques everywhere. That's the most effect to your entire body vessels. So diabetes is not just the sugar. The sugar and the cholesterol clog up by your blood vessel, everybody, that's where the most important thing. Whereby, so you have to control your sugar, so if you prevent any kind of serious diabetic complication. If you have pre-diabetic, you know what? You are the same. There's no difference. And you have to do that. So how do you do that? You have to control your diet, you have to control your exercise, you have to weight management, and then plus you have to measure blood sugar because you have to prick the finger. That's the only way you can do to control, understand. So listen to our webinar and drinking Lowsutea will help tremendously. And we'll teach you all different ways, like decrease stress, mental health, all this stuff to help you better manage your blood sugar. So what's most important, you have to control your blood sugar. It's always the same. 嗱，各位朋友，有啲人未聽過我哋嘅書嘅時候，我要大家 catch 好快。糖尿病最大問題乜嘢啊？就係嗰啲糖加 cholesterol 塞住晒，所有血管成身都塞晒，咁你就一定係全身都有好有問題嘅。如果你繼續控制糖，咁你點控制糖啊？嗱，前期患病同埋糖尿病都一樣，你一定只係繼續控制。控制咧就要將你食啊，要運動啊，要個重磅個 weight management 啊，同埋咧要度血糖咧，知道你幾多血糖啊？咁其實整體咧係有個叫做全個身體嘅 lifestyle 講啲嘅，咁就係冇白食龜膚啦，即係食唔到飯啦，你食好少啦，即係食多菜啦，冇飲蘇打嘅，咁都係啊，飲佢糖係好，飲佢糖就好有幫助嘅。咁最重要咧，繼續係 measure 你一樣嘢嘅，係個 A1C， 將個 A1C 降低6.4以下。So most important, all diabetic and diabetic have to remember. Number is A1C. Every 3 months, the doctor will measure, or every 6 months, your A1C has to drop below 6.4 to be controlled. And as you know, everybody goes through the same 4 stages. First stage is when you have high cholesterol, you will add on the sugar, the cholesterol will damage the B cells, so the B cells will take the sugar into the cells and more B cells come up. So in that result, you have a sudden what they call insulin resistance, and cholesterol goes up, and the sugar add together. You know what? Sad part is you're going to start forming plaques everywhere, the whole vessels. And then tomorrow, next week, we're going to have a lecture by Professor Jay Young to talk about the eye and show you how this vessel, plugged with cholesterol and plugged with the plaques everywhere, how damaged the eye, and that will be a good message for showing you that's exactly how it looked like for an entire body stuck in everywhere. So that will be the most worst damage to your body, and that's why diabetes. This is something that you have to be really worried. And when you have a plaque, you know what? Your big thing is your blood pressure is going to go up because you know the plaques in the air get less space, your blood pressure goes up. Now, if you don't do anything, the stick face is the sugar will continue goes up. Then you have measured A1C. A1C is the hemoglobin, the sugar, percentage sugar attached to the hemoglobin. This is small blood cells that carry oxygen, but what's one thing nice is also have a percent of sugar attached to that. So they measure the percentage of attachment. So usually, if you have 5.7, you're normal. But if you're about 5.7, 6.4, then you are in pre-diabetic stage. If you are after 5.7, you're diabetic. So if you move up over, you're stage 4 diabetic. And thereafter, you'll continue diabetic, will not change, and you really have to control, and you have to change your lifestyle to lower it. But unfortunately, once you confirm it's diabetic, you'll ever be diabetic. It will change the data. So that's something that you have to remember. 各位朋友，每個人咧都有4個 stage 去由一開始到第4個 stage 就糖尿病啦。咁第一個 stage 咩啊？就係當你膽固醇呢個 LDL 壞嘅膽固醇升上嚟啦。咁佢個最大問題咩啊？佢 damage 你個嗰個叫做 B cell 喺胰島素出嚟咧有個 cell 叫 B cell， 個 B cell 帶啲糖入去個細胞裏邊。但係當你糖咧 一路出嚟嘅時候，但係個 B 細路嘅 damage 咁你啲糖入咗細胞咯，咁啊弊家伙啦，點解嗰陣時咧有問題啦？就係因為咧嗰陣時嗰個繼續啲糖出嚟咧，但係亦都入唔到去，因為嗰個 B 細胞出嚟，咁你開始有個 insulin resistance，咁你糖更高咯喎，但係入到個第二個 stage 咧，佢糖加埋啲膽固醇咧，然後個血管咧就會開始發急，咁啊發咗之後咧，佢就會開始一路全身發急咁啊弊家伙啦，因為咧你嘅血壓開始上高啦。咁呢個第二個 stage，其實呢個睇翻呢個咧，你就知道咧，糖係對全身高血壓就係呢個最大嘅問題。咁如果你繼續做嘢咧，你個血糖咧就係有個叫 A1C，A1C 係一個血球，血球咧就 percentage 幾嘅血糖咧係黐咗。如果5.7係咯，但係如果5.7至6.4咧，6.5咧，你仲係叫做前期問題。嗰6.5咧係糖分嘅啫。咁第二個 stage 咩你做咧？咁你嘅糖上去咧就開始變咗前期問題。如果你繼續唔做嘢，第4個 stage 糖尿病啦。咁但係咧變咗糖尿病 sorry 啊，你會變咗糖尿病。OK， 記住樣嘢。咁呢個4個 stage，咁其實我哋有個好處咧，就係一個叫做去糖站。去糖站就幫助你咧，第一有個苦瓜咧就幫你同啲胰島素去increase 咗嗰個胰島素嘅成分，帶翻啲糖嘅細胞嚟。咁就翻上樓面咧有好處咧，佢就將啲糖係delay 咗absorption，即係容易講嘅攞咗啲糖去你個腸嘅血管裏邊啦。咁變咗你兩樣都有嘅時候，糖少喺血管裏邊啦。咁仲有一樣嘢苦瓜有好處喎，佢如果有 excess 嘅糖多咗糖咧，佢尿一掉出嚟，話俾你掉埋嗰啲咩個 LDL 仲有咩掉埋鹽。如果鹽掉咗鹽之後咧，個血糖嘅所以三級高都降低，係 detox 變咗你個排毒養生。所以個十分好嘢嚟嘅。So how Lowsutea work is basically the guava leaves to actually delay the absorption of sugar into the gut vessel, so less sugar going to the gut. But bitter melon has a very effective effect. It increases its insulin, so it takes more sugar into the cells. And then from there, if there's excess sugar, they also take it out from urine, dump it out, and they also dump out the cholesterol and also dump out salt. When you have 3 of this dumped out, also your blood pressure will come down because less salt pressure, less water, salt come down. Plus food detox. So it's a magical, really good product naturally because it's not a drug, it's only tea supplement, it's just a food supplement basically, drinking like a tea. And then you get able to lower blood sugar, cholesterol, and blood pressure. Now, if you do not do anything, for example, I don't care, and I tell you, I have a lot of customers actually have the similar attitude, and you took a long time to change that. They said, I'm taking drugs, it doesn't matter, God will take care of me. But, like what? They really did not achieve the goals. The reason is you really have to make your life so-called a change of lifestyle. If you don't do that, you have an issue of the stroke, you have the cataract. Next week, we have Professor Europe talk about how you will damage your eye. And we have 2 other doctors talk about how to prevent pre-diabetic. And we'll talk about also prevent diabetic complication. So all that will actually affect your entire body. So you're also going to have a higher chance of heart attack. You have nerve damage. That's really bad. Your nerve damage is damage everywhere. There's not only nerve damage on the head, stomach, to be your sexual function. And also when you plug out a blood vessel, your blood pressure goes up, your blood vessel will be damaged. If you got hurt, the circulation bad, you know what? You can chop your foot. And if you damage the kidney, you know what? You're going to end up with diabetic nephropathy, meaning that you have to do your dialysis down the road. And 30% of diabetic patients have no sex function because they can't feel. Damn, the nerve damage here. And when you're pregnancy, you can potentially become gestation diabetic. In the future, you're going to have diabetic problem. We have a lot of examples. So you got to take yourself. You have to control your blood sugar. If not, you can have end up serious health problem. A lot of people don't realize. You may say, "Wow, I'm looking up right now. I'm healthy," and I have a patient just tell me that too. 53 years old, she was diagnosed with diabetes. At 65, then she realized that, oh no, I'm in trouble. My diabetes is out of control. The doctor said, if I don't do anything, my kidney will fail and I need dialysis. So she took that almost 12, 15 years before she found out that she's in big trouble. That's how long it takes. But once she's in trouble, if she don't do anything, she really end up with dialysis therapy. And that means every week at the hospital, wow, all kind of problems. And you know what I mean? At a high medical cost, and really the quality of life just shouldn't go down. So you got to really work on it. And remember, in the first 5 years, man, nothing happened. But afterwards, you have serious problems coming in. Okay? 嗱，各位同學，如果你做嘢咧個問題咧，就第一唔係咁大嘅頭樓啊，但係你5年後咧就可能有嘢出現咧就好鬼家伙嘅。第一你可能中風啦，第二有青光眼咧睇唔到開始盲啦，你個腎出唔到胰島素嘅時候，你越打胰島素啦。最大問題咧，有好多人咧就有心臟病，我幾個堂友已經喺我呢度咧係有心臟病，個原因就係啲糖太高，塞住個心血管，咁啊好弊啦。咁同埋仲有咧有一個問題咧，好耐唔知原來神經喺度傳，唔記得同埋咧啲嘢咧個感覺唔到咧，好弊啦！你有腸胃問題啦，有腦嘅問題啦，好多問題出現嘅。咁同埋仲有咧個 damage 個 blood vessel 亦都有好多問題。當你 damage blood vessel 個血流到上去啦，塞住晒啲血管脹嘅時候咧，傷咗啲血管流上啦，翹唔到啊！咁你要斬咗腳，哇！咪家伙啦！仲有洗腎啦，如果你係個腎跌到去30%嘅時候，你要洗腎喎嚇。上一次professor Larry Chan 都講咗啦，所以你一定要注重呢嘢。咁原來30%嘅人係唔成功，因為佢冇感覺，比較個 nerve 咧神經係都損毀咗。咁如果你 pregnant 咧，亦都係要注重呢樣嘢啦。所以咧好多呢個問題咧真係要處理嘅。如果你唔處理，有好大嘅問題出現。嗱，我哋公司有個好處咧就係咁多方面。第一教你去好多嘢咧就第一帶你做啦，第二飲去糖茶啦，教你做 exercise 啦，再教你 weight control 啦，同埋我哋亦都有好多即係醫生講咗同我哋講咗咧，日日都加增啲新嘅點樣能夠管理大嘅 management。嗱，其實呢個好特別嘅，咩 fact？我有幾個好資深嘅醫生話嗱，我喺市面上聽到其他嘅公司係全講食嘅，即係你咧。多病大嘅病，即係管理點樣同佢哋，所以好重要。你 track 啲筆有制度化呢啲人，我希望咧能夠幫你 A1C 10以上都要跌翻呢個點制。So we have actually our company is very unique. We have a 5-week program to help pre-diabetic patients how to manage the diabetes. Now, matter of fact, there are quite a few doctors say, Andrew, that's very good study. You know why? Because majority of people that talk about is all diet, but not talking about total management. So we have over hundreds of lectures talking about total management. Plus, we get answers to the questions you can ask to help you guys out. And that's very important because don't forget, diabetes is a lifelong disease. If you do not manage it, you're going to get about 5-6 years later. Big trouble. And in order for you to really manage the diet, it might not be really helpful. Or you can be helpful, only stop at the error. But you cannot get previous improvement because once the damage is damaged. So very important, you got to start now to control. Make sure you lower your blood sugar all the time. You have to exercise. You have to weight control. You have to decrease stress. You have to listen to the doctor regularly to manage. And manage your blood sugar to understand where you're at. We have help many patients with the A1C drop 10% plus all the way to 6 and 5.7. Where a few customers already actually did achieve 5.7. They're so happy. They said, wow, I can able to do that. So that is our goal. Now, certainly, I want everybody to listen. Really to set your goal to go below 6.5. 6.5 below. You know, you have to be at least 6.4 below. Okay? Then you have something to to strive at all the time. And yes, it will take effort. I can assure you, it doesn't come easy. It takes effort. Okay. Okay. So now we talk about how to handle diabetic depression. Okay. Now, the reason why I took this topic out is because we have a lot of issues in Hong Kong, I'm sure in Southeast Asia, in Philippines, everywhere is the same, United States. And I talked with a patient in the United States also, and Canada. And they said, during the time when COVID, if I'm sick in the United States, for example, I can't get a doctor appointment because they don't want to see me because they think I might have COVID, right? And so they really have very little understanding your real actual disease. A lot of times they say, I want a renal conference with you. Okay. And basically, a lot of these come up and they even don't even have time to talk longer because of the COVID situation. So a lot of time become more and more stressful on all the discussion and all that. So become really not easy environment. Okay. So end up a lot of people start getting fear, depressed, and so forth. In Hong Kong, it's the same thing. That's why we want to talk about this today. 嗱，各位朋友，其實點解我今日會講呢個咁得意咧？係咪真係咁重要咧？咁重視咧？係，因為咧，我係喺香港有5萬幾個人染病嘅時候咧，好多人好驚，同埋你見到好多大叔今日講過咗啦，88%嘅人咧都有長期患病，好多係糖尿患病啫，係死嘅。咁你話俾幾弊啊？咁好多人咧就話：哇，我想見醫生，醫生話唔見你喎，第一。第二，逼唔到人開門喎，因為依家個都驚高病啊嘛，咁啊佢唔見你，咁啊睇佢醫生，咁你自己管理喎，咁你已經 stress 就大啦。咁其實咧，呢個 stress 咧係會 affect 咗咩啊？你個 mental health，你個即係成個心理影響你心理嘅健康。咁點解會做呢樣嘢咧？因為糖尿病咧，第一已經係一個好驚嘅東西，好多人話你糖尿喎，咁已經係逼咗一樣嘢咧，話要 manage 個 blood sugar 啦，要 manage 我所有嘅督手指啦，又要食藥啦，又要管理點樣能夠令佢血糖降低啦，8樣咧好多壓力啊！咁原來咧10至15%嘅糖尿患病者咧，會係真係有個 depression。咁呢個 depression 咧要真係早啲知道，因為如果唔知道咧，個 depression 越差嘅，咁變咗越差嘅時候咧，糖一路高嘅。咁變咗嚟講咧就係一個 catch-22 啦，咁變咗又有你。衰咗喺個心理健康度啦，你糖又高啦，咁啊呢個咧今日咧希望呢個 lecture 裏邊咧俾你了解乜嘢叫做糖尿病，能夠令到你個即係壓力好大。咁如果你知道點樣解決咗咧，咁你就好大幫助咯喎，係咪？So today's lecture is going to be very helpful for you. The reason is we have a lot of patients actually working with me, talking to me. That we all are very stressful because I get to see my doctor, and they are really affect the mental health. And actually, I can see that's difficult because a lot of people say, "Wow, I'm really sad. I cannot see my doctor. I'm very worried. I'm very scared. And on top of that, I have a real problem. Because I even can't even get an appointment to see my doctor. Imagine that." And I don't know where am I at. So all of these are really stressful now, especially when you first identify you have diabetic. They're even also stressful. You know why? Because one, you realize you have a lifelong disease. Second is how it's going to progress from here. And so all those things will add on because now you're going to measure blood sugar all the time, taking a finger all the time, eating medication all the time, and you have to continue to drive the blood sugar down. So if you can't drive the blood sugar down, even you get worse because you're going to get scared. Okay? And the study showed that 10 to 20% diabetic, they will have a difficulty once they heard about a new diagnosis disease. And many of them, 10 to 50%, actually is because of that, they start developing depression. So in order for you to really quickly control that symptom so you don't get depressed, because when depressed, it creates stress, the blood sugar goes up, you'll be out of control. And you really want to make sure it doesn't affect your mental health. So today, we'll give you all the tips to identify what are the depression like and what can you do about it. And that's become very important because you don't want to continue depressed. And I had patients that is so depressed they actually end up saying, I really don't want to live that long. Wow, I was so scared because I said, you can't do that. So I took a long time covering that. And eventually they open up, cry a bit, and they feel better. And so they will say, okay, I can now know what to do. And that's so important. Now, keep in mind, when you have stress, you make diabetic management extremely difficult. Because you know why? Stress increases blood sugar. Now, I tell you quite a few stories because I measure myself using this called diabetic, this thing called liver. You know, this little gadget. And that's in Hong Kong. I'm quite a few of my patient Evan. Now, right now just had breakfast at 6.8. But you know what? I found that if I am stressed, and I actually asked some of my patients who use the same measuring stuff, and they said, okay, you're 6.8, that's very good. But I found many of them go as up at 9 because they're stressed, and they have 10 because they're stressed. So it's so important to measure to understand if you're stressed, it does affect blood sugar. And because when you're stressed, blood sugar spike up, your blood pressure goes up. Now, I don't know if you guys ever measure yourself when you're stressed. I do measure just to test my hand. My normal blood pressure is usually about 120, 125 max. But if I am stressed, my blood pressure goes up at 140, 150. Wow, that is going up, boom. Okay? My heart rate goes up, boom, 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 because you're stressed. And then it also impacts your whole well-being. You will be all grouchy. If you're really stressed, you disrupt sleep, you don't sleep well, you toss and turn, you have bad dream. And then if you continue to stress, you're going to start getting what? Also bad habit. Okay, better than smoking. You have to drink alcohol. You're going to have, if you're stressed, a lot of people eat what they do when they're stressed. Eat. They start eating snack, eating little chips, all kind of stuff that comes in, which is totally not good for you. Because you get little chips what happen? Boom, blood pressure. So stress definitely measure by saying that it is bad for you. So make sure that you have to control that stress. Okay? 嗱，各位朋友記住，因為咧係好有多我哋嘅朋友咧都知道原來咧，當你係好多壓力嘅時候咧，你糖尿病咧本嚟係一個好難控制嘅。點解啊？因為如果你係 stress， 尤其是我都知道咧用呢個去度嘅時候咧，我睇到自己咧會係一班6.5啊嗰種西嘅，你會上咗去咩啊？哇，9啊有可能，有啲朋友話俾佢聽，如果係 stress 係90都有。所以其實咧係好重要，知道咧，如果你係好即係壓力好大咧，其實影響你血糖好多。點解會咁咧？就因為你 body stress 嘅一陣爆咗出，俾啲糖你準備打仗，咁你嘅糖就升咗上嚟，你個身體全身做多啲糖出嚟咧，幫助你準備嚟打仗。咁你就 stress 就弊家伙啦，你唔想啲糖上嚟啊嘛。咁你一定要減翻啲壓力咧，上降降低。咁仲有咧 stress 嘅時候仲有咩啊？你血壓會上升。我自己係㗎，因為我落過咧，如果好 stress 嘅時候，血壓上到150度，我諗哇，我嘅成150度啊，點解會150度啊？所以呢個唔係好嘢嚟嘅。你 heart rate 亦都上嘅，110度、110或100會 stress 嘅，因為會 heart rate 上咧。咁同埋咧，仲有咧，你會自己好掹震啊，你個成個人好緊張，咁你個時候咧，你就成個 emotion 嘅心理咧都好大嘅。咁仲有，如果你好 stress 啊，瞓覺瞓唔到，你嗰個好嘅睡眠點解咧？你 toss turn 去喺呢度啊，咁樣又發惡夢啊，呢度好 stress 啊嘛。咁所以整體咧都係令到你唔係一個好東西。仲有個問題，當你 stress 嘅時候，多數我唔知問下你自己，我諗你都係㗎啦，我都會係嘅，但係我就知道自己控制啫。當你 stress 嘅有個問題咧咩啊？你要食嘢啊！食咩 chips 啦，食飲酒啦，食煙啦，當然我冇呢樣嘢，但係我會食嘢。食咩啊 ？chips 啊嗰啲西啊，或者食其他嘢啦，谷薯啊，又係咁照。 因為你 stress。所以咧，當我 stress 嘅時候咧，我唔擺呢啲喺度嘅，因為擺喺度咧，我好快就撳一聲走嚟食。所以呢啲係好大嘅管理嘅你堂嘅。所以既然 stress 係會影響整體嘅。So keep that in mind when you are stressed, you gotta relax yourself. If not, it will hurt you because blood sugar will goes up. The average blood sugar that day when you're stressed will go up as high as maybe 140, 150, 160, or even 200 because of that. And my friend have this in the US. I asked them if you're stressed, they measure yourself, they were shocked. They would say, wow, I didn't know my blood sugar would go up to 120. From 120 go up to 180, 190, 200. So that's how far it goes. In Hong Kong, you know, we are basically 6.5 go all the way to 10 or 12. So you don't want to be that remote, okay? So remember, stress affects your blood sugar. You got to be careful. You don't want to do that. So to control your pre-diabetic, besides drugs, unfortunately, you gotta change your lifestyle. Now, I talked to a lot of my customers. They said, man, you know, I went to the doctor, I paid him a lot, especially private patients. I paid him a lot to give medication. I said, okay, I just depend on medication. Is it true? No. If you don't change your lifestyle, even though you get more and more medication, it might not necessarily bring your blood sugar down. So don't think that just depend on medication will make sure your blood sugar can always go down. Now that concept, in a sense, that some of my customers are fairly wrong because they said, I take my drugs, I'm good. I will be able to control my blood sugar. But unfortunately, the reality is not necessarily. You have to really control by the whole lifestyle change. When you do that, you take less drug, you'll let better blood sugar, you're healthier. I'll give you one example. I have a restaurant manager who is, he is pretty good at very so-called colorful lifestyle because every day he ate a lot. Every new dish you would try, and you become very, happy because I try all the expensive food. Unfortunately, a few years back, your stomach is not getting bigger and bigger. Your weight is going to control bigger and bigger, and then you become heavy weight. Eventually, become diabetes. And become diabetes because he had money. So he said, "Well, no worry, I will take medication." So he go to a private hospital, get medication, And he said, "Andrew, I already paid this guy so much money. Why can't I just take my medication to get better?" But I said, "Look, have you measured blood sugar?" Yeah, I did. And then I started realizing it's not well controlled. His blood sugar is always 10 and 11 and up. I said, if you come 10, 11 up, you need to get 200 and up. 200, remember, deal is high. All the time is bad for you. In other words, his A1C will be 10 and 11, 12 above. So imagine that. That is not good for you. You don't want to be in that boat because in short term, you might not feel it. In long term, meaning in about 2 to 3 years, you're going to have all kinds of problems to come about. And it's too late because at that time, you can't reverse it, okay? So, don't really just depend on the drugs. And most likely, you got to change the lifestyle. It's not most likely. It is going to need to change the lifestyle. And certainly, the doctor usually say, wow, you have to control your diet, stop eating sweet, avoid alcohol, avoid sugar. Yeah, you can do that if you can change your lifestyle. But a lot of people don't realize you also need to change by getting exercise, weight control, track your blood sugar, prick your finger daily. And then you can also, if you are out of control, you might have to actually inject insulin. And all the stress that come in together is also create emotional reactions. So all the stress. Okay? So medication might not necessarily bring down your blood sugar. Keep that. 嗱，各位朋友，我講個古仔俾咧，我有個經理咁樣啦，譬如話，喂，我係睇私家嘅喎，我亦都咧係揾我醫生嚟睇，佢係俾咗好多藥我食，咁 我話你唔好㗎，點解唔好啊？因為佢其實一個呢個高級經理啦，佢係好正嘅，因為佢幾年前咧就日日有啲新產品食啊，哇！一路咁肥，一路加磅，佢肚腩越嚟越大。咁弊家伙啦，咁佢幾年前咧就已經做咗堂。佢話我點解唔得咧？我話我依家係白色藥俾喎。但係當佢夾多啲溝咗嘅時候，原來咧佢自己嘅 lifestyle 冇 change，佢喺度肥胖，個肚腩越嚟越大。咁弊家伙啦，因為佢依家咧其實已經係佢糖尿係控制唔到嘅，因為佢 A1C 去到10幾以上，佢個 average blood sugar 咧已經係去到10啊、12啊、13啊嗰啲咁。我話你繼續落去咧，你會會有好大病出現。咁其實呢個整體講嘢咧係一段好長嘅時間。佢先 realize 話咁樣落去唔得㗎，即係佢覺得自己我依家生活都幾好啊，食乜都得，啊我就食藥得啦。咁其實食藥係唔得嘅，記住食藥係唔得嘅。你一定要生活習慣都改變，要食咩咧？要生活條低量租啦，即係你個 low carb diet咧，低嘅碳水化合物食物啦，要做 exercise 啦，要 check 你嘅冰嘅 measure 乜 sugar 幾多啦。仲有咧，如果你真係 lost 咗佢又打胰島素啦，同埋咧你要真係唔好 create 咁多 stress 啦，因為 stress 繼續係 increase 咗你個 blood sugar 同埋 emotional 啲 reaction 會大。咁呢個朋友咧，佢雖然係一個好即係好有錢啦，可以講為佢生活係好正嘅，即係酒樓老闆啊，因為佢都有。但係我哋咧，佢個問題咧，佢個生活習慣全部揾唔到咧，直食藥咧係會第時同佢一樣。咁佢依家先最近咧係 realize，呢樣嘢係唔得，我係要改變生活習慣。咁依家先慢慢改啦。其實咧，呢個已經係 first step， 因為如果唔係咧，佢會係3-4年後咧，佢會係有 heart attack 啦，可能會腎壞啦，腦出血啦，哇好多嘢出現。所以呢個係一定唔好以為淨係食藥係咪能夠會醫到你？唔係，仲要 lifestyle change。Now, so imagine you now identify yourself as a diabetic or pre-diabetic. All those stresses that come because you say, wow, what will happen to me? And will I get worse? And so forth and so forth. So everything that comes into you, you're going to start realizing that might be scary. And eventually, you got to read, if you don't, keep worrying, you might end up with depression. So stress can lead to depression. And it's important to recognize that what is the sign of depression, and that's what I'm going to show you today. And you got to remember some of the signs. Hopefully, you know about this and get to know them and get a treat early. Now, I tell you, because you will be living with diabetes for lifetime. It's not like 1 year. It's not like 2 years. It's a lifetime. You will live with diabetes forever until the day you die. So you will be the one that continue to manage, continue to control your diabetes, and you really have to find a doctor not only treating you for your diabetes, but also recognize how it can help your mental health. Make sure that you got depressed, there's someone who are professional know how to handle your mental health to help you to prevent the depression. And that becomes a very important sort of structure yourself and make sure that you have this. Now, 各位朋友記住，因為壓力大咧係會令到你有可能咧有個叫憂鬱症。因為首先第一，當你知道話我前期患病咯喎，咁啊第時我變咗糖尿病咯，我唔知點算咧，我會係有病得好慘咧，呢咁嘅顧慮嘅，慢慢咁就加埋你身體上不同嘅有問題出現啦。仲有咩咧？仲有其他嘅地方好似 COVID-19 啊嗰啲又出現喎，咁又加咗壓力喎，咁你會好多嘢夾埋嚟咧，咁你又覺得哇好壓力好大，你就開始有可能係點憂鬱症。咁但係呢樣嘢咧，你一定要知早啲 recognize 少啲知點解呢個係憂鬱症嘅先嚟喎。咁我哋知道咧點去陣間要處理啦。第二，記住同 糖尿病咧係一世嘅病嘅，即係你係會繼續咧，永遠咧同佢一齊同佢生存，一齊生存啦糖尿病。咁你一世去到死嗰日，你都係有糖尿病嘅，所以咧你一定要繼續幫助你自己點樣處理，令到你唔會病得差嘅。但你仲有嗰啲醫生咧係適合醫你咧，如果有情緒問題咧，可以醫到你嘅。咁呢個係一個好重要嘅部署啊！呢個部署咧，你要有呢個部署嚟幫助你咧，係有呢個 support 支持你如果你真係有 depression。嗱。I would think that it's a good idea you take a picture of this one because you know what? This is the typical sign and symptom of depression. 應該同大家影張呢個相咧，因為咧好多時咧你太多嘢睇到出嚟，呢個係可能係個 depression 喎。So this is a picture that you need to know that you have. If you find some of these symptoms, then you may need to start early looking for help. For example, depression would be feeling empty. I don't know what to do, man. You know. And a lot of people actually feel guilty because I'm diabetic. Shit, you know, I'm diabetic. They feel real guilty. They feel real sad internally. And they feel hopeless, despair. Oh, man, I'm diabetes. You know, I'll never get well. I'm going to die. That would be terrible. And many become so depressed they don't feel eating. They don't eat. They feel, look at food, they have no appetite. And worse than, a lot of people cannot sleep, insomnia, because they keep thinking about the disease. What happened? And if you have insomnia, you know what? That also affects your blood sugar because you can't sleep. You get stressed coming up. And then a lot of people, some people just sleep a lot because they don't feel like doing anything. They're depressed. They don't feel anything. They sleep a lot. So with that, they feel lethargic. They don't feel energy. They don't have energy. They don't feel like doing nothing. And also because they are depressed. And this is a very common symptom. They can't make any decision because they're depressed. And they will just kind of stand still, don't know what to do. And some of them also have total irritability. In other words, they feel little thing, they will be very irritable, and they will blow up, and they will have a lot of anxiety. And they also have ache and pain, and they have digestive issue. And they also, at the end, they have suicidal mind, and they want to die. Okay? And I tell you, when a customer actually talked to me, and I need to really cut them to talk to eliminate the suicidal in the head. So they would say, hey, you do have hope. Okay, don't worry. We'll help you together to go through this difficulty. Okay? So those are all there. And I will tell you one example. We have a patient. Actually, this is nobody who talked to me. And he keeps saying, he's a diabetic. He keeps saying he has stomach problem, a pain problem, with the back, blah, blah, blah. And the doctor looks through everything. It really doesn't have much problem in a sense clinically. But you know what? All those is because the depression and stress create all those psychological things again. So pain, back pain. And so they basically treat her, this particular patient, decrease the stress, decrease the depression, and what? The pain go away. So that is really all these things can affect because depression was cited this science. And you really have to have people like those. It's not the may not be feeling best, could be an endocrinologist to help you to understand or refer you to a proper, psych help you to talk about your emotional problem, to help you become, recognize your stress and recognize your depression. So that is important. That's why I want to take a picture. Okay. 嗱，各位朋友，我就係叫你影張相嘅原因咧，因為都好多 science 即係好多人咧有咩症狀出嚟咧係會有呢個憂鬱症咧。嗱，第一好多人咧有憂鬱症嘅時候，好多嘅感受咧，好似死啦唔使嘢，好多人亦都有內疚，非常感覺咧就好傷心，同埋咧覺得好似絕望。呢個是大問題絕望。 好記得，如果你絕望咧，你就好想做嘢嘅，你又唔想食飯嘅，你係成日瞓覺嘅，咁亦都好多人咧瞓唔到覺嗰啲嘢會失眠嘅，咁亦都講頭頭暈暈會好難解決方法，又唔會逼到自私人解決啊，咁亦講有啲人係好嬲嘅，因為佢話哇搞錯係我，有啲人 deny 嘅，有啲話唔係啊，點解我嘅？點解會有我咧？咁亦都有好多焦慮嘅。有好驚嘅，驚嘅時候，好多人咧就會話我肚痛腰骨痛啊。咁其實我應該話俾你聽，我有個病人咧就係咁啦，因為佢醫生呢個係醫生話俾你聽，佢有個病人咧，佢成日話佢有肚痛、腰骨痛，其實佢睇唔到有咩令到佢係咁嘅，但係其實佢因為 depress 同埋佢有 depression 症，咁佢就用咗即係個身體指話咧，我有呢個痛，最後咧就揾咗即係心理醫生啦睇咗之後咧。管理咗呢樣咧，咁佢肚腰骨痛。之後好多人咧就會係消化問題啦，同埋最尾咧自殺。呢個咧係一定要處理。如果你俾個 depression 繼續落去嘅時候咧，個自殺觀念咧一路上嚟嘅時候咧，發現㗎真係會有人自殺嘅。所以我咧都同好多病人開解咗啦。原來喺佢講晒之後咧，一路了解到，即係有即係半個鐘頭開解咗佢。俾多一個有一樣嘢好重要，我俾一個 hope， 俾一個希望。我話你一定好，因為如果你控制到咧，你就見到咁呢個咧就幫助佢呢個好大嘅，因為如果唔係咧，佢真係要整樣，我冇屋冇死㗎啦，差㗎啦。佢呢個咧就變咗一個好嘅東西啦，記住啦。記住咧，呢個影翻張相，因為呢個係對你講將來叫 identify。你嗰個即係憂鬱症咧，呢個係一個好有幫助。So， 如果有呢樣嘢嘅時候，一定要去睇醫生，因為自己醫唔到而家。咁同埋咧，遲啲又教你哋點去傾多啲情況啦，就係咩 ？So keep that in mind. Make sure when you are depressed, take a picture of this because this is all the typical symptom of the depression. Now. One of the things that is also the stuff that called diabetic distress. Now, diabetic distress is basically you develop the feeling of despair, like wow, I'm hopeless now because of diabetes. Okay, and this is a problem that comes on if you don't take care of it, you will basically end up with real strong depression. Now, because basically what happened is the diabetic who said, wow, I lost control of my diabetes. And I think all effort come out. You know what? It's not working. My blood sugar goes up. And instead of I controlling diabetes, the diabetes control me. Oh, that would be terrible. And they create, all kind of problems come up because of diabetes. I mean, health problem I'm talking about. So it's no longer just the blood sugar now. It's going to be also heart. It could be the eye. Could be kidney, could be my very common is nerve damage, whereby they will have all kind of problem comes on. So they will have all kind of condition. They will feel tremendous despair, and they might start giving to say, "Gee, I really give up. I don't want to stop anymore." And so net result, they further putting far away from the actual reality. In other words, they could be treated, but they won't do it because they're so stressed and they're so despair. And because diabetic patients, the mental health continue to develop, they will get depressed, they will further anxiety. So with that, you have to focus to treat your diabetes. And that really need to have a doctor to understand this, who are diabetic distressed, and continue to treat you on the issue of distress and make sure you don't go to severe depression. That's very important. Okay. 嗱，有個糖尿病困擾咧係一個好大問題，因為你全部都嘢都喺糖尿病開始做出嚟咧，你要開始佢好多嘅全部嘅感覺啊。點解會血糖感覺咧？因為第一啦，你又會你要同你要控制好多嘢啦。啲糖會跌落嚟啦，但係好多時咧覺得控制唔到血糖喎，呢個糖尿病控制我喎，弊家伙啦。同埋仲有咧，好多糖尿病者咧開始出現有其他問題， 大嘅問題啦，心臟問題啦，可以壞心臟啦，血壓嘅問題啦，腎嘅問題啦，同埋仲有咧就係仲有咩神經系統問題。神經系統問題咧，好有問題就好多時咧會感覺唔到啊，或者有好多痛症出現啦，好多嘢好煩嘅東西。我其實都有幾個呢個堂友出咗現咧，就係佢個腳或者隻腳隻眼可以起泡，腳眼嘅起泡，起泡之後咧就好難好。咁呢個咧係好煩，因為佢着嘅鞋又痛啦，行路痛啦，仲有咧就係好啦。咁變咗係令到佢成個人咧係好頹喪，好結婚。咁我哋要好講咧嗱，即係要話咧俾佢發現啊，因為如果俾你講啲腳啊，佢都驚到震啦，係咪？最弊咧就係即係呢啲咁嘅嘢咧係令到好煩，所以其實咧呢啲咧就一定要教佢哋咧，第一喂控制下血糖啦，make sure 咧佢係繼續行去醫啦，因為最弊如果結合咗咧，醫翻你唔醫嘅，你唔去睇醫生，亦都話算啦，哇咁啊弊啦，因為你一路做咧一路住衰落嘅，喺你個糖咧即係你要繼續高嘅，咁啲人咧就會開始越整越驚，越 depress， 越 give up。咁其實咧，呢個咧係一定要做一樣嘢，係 focus 去搞掂咗個糖，嗰啲嘢就自然好嘅。咁所以變咗咧，要幫佢搞掂糖咧，仲要咧係有個啱嘅醫生咧，喺佢即係精神上嘅管理咧，佢醫療上嘅管理，幾樣嘢一齊試開做。咁呢個diabetic distress 係一個問題中嘅問題啊，所以唔好忽略。Imagine, make sure diabetic distress is a real important issue and you can't ignore it because all that the distress came from what? Diabetes. You treat the diabetes, what? Then the distress will disappear. So it might be a simple thing, maybe just a blister on the foot. That can be really terrible because you get pain or you might not pain because it's like getting worse and worse. If you don't treat it well with what, that becomes gangrene, you have to amputate a foot. So you gotta take aggressive action to do it. So you gotta be really on top of it, right? So that result, that you don't wanna give up. No hope. That's terrible. Don't let that happen, okay? Now, some other confusion when your blood pressure goes down. Now, if your blood pressure high or low, especially low blood pressure, you also feel really hopeless because you feel tired, I don't feel like doing anything, and so it looks like depression, but it might not be depression, but it's just because of blood pressure issue. So you have to talk to the doctor and say, hey, what happened to my blood pressure? Is it real? My blood pressure like that? So with that, then you can understand, wow, okay, maybe it is something that's not like depression, is just a blood pressure. But that is so much things that they talk about. You need to really check, you got a doctor to check with you about what is the body cause you low or high blood pressure. 嗱好多時咧，有啲人係血啊高低啊，都好似 depression 一樣。如果你血壓低咧，你冇神經喐唔到嘅。咁所以咧，你就會 action 咧就未必係 depressed， 但係你應該要需要你自己去幫助你了解點解你有呢個血壓高或者低嘅問題咧？呢個咧你就要揾醫生 check 你 body 你個身體上有咩機制咁樣點解你會低嘅 ？OK。Now keep that in mind when people are depressed, especially diabetic. Sometimes it's difficult for the doctor to diagnose you are diabetic depression or you are getting depressed. The reason is because the people are depressed. They don't want to go to see doctor. They are scared to go see doctor. The reason is because they worry about the doctor give me a typical diagnosis that will be very scary, tell me how bad I am. So they really said they worry about treatment, they worry about financial issue, overall health costs, also all the other organs that involved. So with that, they are really become an item that will be hard for them to face. So that become a sign getting back to a possible depression. So very important, you have to recognize you are treating a diabetic patient, if your diagnosis, the depression might not be as easy as you think because they don't even want to see a doctor because they are so depressed, so scared, they don't want to go there. So the family might need help because you need to talk to your family to tell them, hey, man, mom, you have to go see the doctor, okay? So these are the things that you have to watch out. And we have to really, at the end of the day, you have to maintain a positive attitude to basically you say, hey, I do have hope. I can control this. I can make choice to treat my diabetes. Now, if you have only a negative emotion, that's okay too. You're angry and guilty. But the important is your positive attitude, even your angry emotion, I'm saying, I'm diabetes. But if you're positive, say, okay, I will go there and fix it. Even though you're angry, you're guilty, but because you're positive, you're going to set goal to improve the situation. So that will be okay. The worst is you're not having positive attitude, you are negative emotion and negative attitude, that will be terrible. You don't want that, okay? So keep the positive emotion up. Positive emotion, positive attitude up. So even negative emotion, you can fix that. Positive attitude is so important. Keep that in mind, okay? 各位朋友，如果你係糖尿病病者咧，你係已經有即係呢個憂鬱症嘅咧，好多時咧，醫生好難走去話俾你有憂鬱症，因為好多時咧，當你係就嚟入到呢個憂鬱症嘅時候咧，好多時咧你唔會喺揾緊醫生，我唔肯去睇醫生。個原因咧就係因為你驚住睇醫生之後弊家伙啦，然之後話俾你我啲呢個病嗰個病。有啲人咧直情話唔想睇醫生啊！我驚住人第一話睇醫生，話俾佢邊個病啦。第二咧有 financial issue 咧，即係要俾錢睇醫生啦，同埋仲有好多不同嘅我身體部分又唔好啦、眼唔好啦、腎唔好啦，呢啲有好多人咧唔想知，即係驚住呢個知道嘅大公司就咪啱我啦。咁其實好重要咧，你要有個真係有個 positive 啲嘅態度，即係積極啲態度。就幫助你有一個好嘅健康嘅選擇，幫助你決策去點能夠醫治呢樣嘢。如果你有一個積極嘅態度，頭先講正面啲嘅態度咧，咁你唔會咧就話我唔醫啦 ，OK？ 因為你正面啊嘛，你積極啊嘛，你會一定會醫啦。嗱，就算你係好嬲嘅，你有個嬲嘅 emotion， 即係話我有死啦，哇！而家冇啦，有呢個糖尿病搞錯啊，好嬲緊要。最緊要就積極係有 positive 有正面嘅態度咧，咁你會做嘢，你會身體高進，你會有個即係目的，我一定要勝呢個糖尿病嘅，所以變咗嚟嘅，你一定係做到呢樣嘢咧，係會幫助你，好過你係話我係叫乜話唔得 negative， 即係唔係正面態度啦，仲有大家你又要有正面嘅情緒啦，咁你就唔係㗎。所以正面情緒、正面嘅態度係好重要，積極態度。Okay, so the next question is, how are you going to prevent depression from the diabetes? Okay. Now, very important, you have to always ask the doctor for a solid treatment plan. Because if you create a right treatment plan, you know where to go because you already have a treatment plan. Hey, I will do this, and my blood sugar will drop down from 10 A1C all the way to 7 and then 6.5. And I will have goals to measure. Within 1 year, I will get this. So with that, it's so important because you have goal, you have track, target, follow through. You will change your lifestyle to accommodate this. That becomes a very important step because I will do my exercise, I will take my medication, I will drink Lowsutea, I will also control my weight. Even my big belly, I will lower it. My BMI will be from 32, 34. I will drop it down to 25. That's my weight BMI, okay? So with that, you are now have a target to accommodate, to achieve to lower your blood sugar. Now that will prevent you from becoming depressed when you see your progression. You step by step. It's not really fast, but with step by step coming down slowly, slowly, slowly. That becomes extremely important. Now, also, you have to seek a good endocrinologist, which is going to be able to measure and work together with you, measure your diabetes. Instead of just a GP, might not be, or family medicine, might not be fully understand how to control. Now, some family medicine is very good, so you have to understand which family medicine doctor to help you who is strong in treating diabetes and also able to give you mental health support because that becomes very important because you are lifelong disease. At times you might be very depressed in some way or you will be moving to depression. You need someone to support you. And when you're diabetic low and with timeline achieved, your blood sugar, exercise, jog it down every week. I did 150-minute exercise. My blood sugar goal is this. I will do 10,000 steps. And plus, at the end, I also join what? Diabetic support. I have a patient support group, so people come to talk about the problem. I can help them. Wow, that is so wonderful. Because that result that the patient support group help you to gain those support and recognize all the problems you have. And that will sharing the problem and also getting doctors and maybe nurses to help you out. So then you become a big different support and you will not feel depressed. So maybe with that, then you can prevent all the feeling of depression because you share your problem with others. Oh, I didn't realize I'm the only one. Or other people have the same thing. Okay, then you can able to feel much better. You don't have all these pressure and once you get a solution, doctor, nurses, and the support group. So that will really help lower the chances to get depression. 嗱，點解預防呢個糖尿病者感到上爽咧？好重要，第一咧就係、你個醫生同埋你護士幫助你，俾一個係好積極係好嘅，即係treatment plan 嚟，即係有一個醫治嘅管理成個系統性嘅計劃俾你。For example，我要 A1C 由10至到6.5嘅，係點做咧？我會開始有單腳租啦，節食控制啦，如果做 exercise 1萬步啦，我會亦都減肥啦，近成31個 BMI 啦，我減到25啦，我點減啊？慢慢減落嚟嘅。咁呢啲咧全部咧就要寫低佢，睇住。咁你睇下，哇幾好喎！我1個月前已經係250磅嘅，我依家已經係230磅啦，好哇咁 very good 啦。一路做嘅時候咧，咁你就開始有 motivation 做。咁同埋仲有咧，就要揾個好啲嘅即係真係嘅分泌科嘅醫生啦，即係內分泌醫生啦，即係 endocrinologist 啦。呢個內分科醫生咧又好重要喎，點解咧？因為佢真係知道條路係乜。嗱，雖然如果全科醫生未必係可以用呢個嗱，如果你有個好嘅家庭醫生係可能得嘅，因為家庭醫生咧有好多人專業服務嘅，亦都有個家庭醫生，亦都知道咧點樣處理個咩精神狀況好嘅。OK， 咁同埋咧仲有一定要失啲即係目的俾你，有時間性幾時我係落邊糖幾多，同埋咧我糖尿嘅水平喺呢度邊量幾多，重磅幾多，磅數幾多同埋咧我 exercise 要幾多，一個月一日做1萬步啊，一個禮拜做150分鐘嘅 exercise， 呢啲全部要知道目的嘅，咁能夠咧同佢做咗更加啲叫做 support 糖尿病嘅小組。咁大家你知道我知道啊，我同你差唔多嘅喎，咁我亦都可能夠你俾 support 我，俾 support 你。咁呢個咧係一個好重要嘅，當你大家 share 同一個問題咧，呢個同間時咧係比較 low 啦，你唔係自己一個人啦已經。我係可能會 share 嗰啲 problem 啦，我亦都揾啲醫生解答好啦。咁你成個生活咧，因為呢個糖係一世嘅病嚟㗎。如果你係有好嘅 support 嘅話咧，你個人咧好 快去同錯，亦都唔好快出去哭。其實冇哭咧係對你個 depression 係好重要。如果你冇哭咧，即係冇咗期望啊，咁你咧就可能好快脆咧就變到係 depressed，咁你又比較。The most important with all these things we talk about, goals, you have to see improvement. The best, most important is to prevent you from depression is we have hope. If you have hope, you know what? Most likely depression, the risk of getting depression minimized. You have to consider hope, see yourself, and goal to set, get yourself, moving forward, see improvement, then you will have less chance to get depressed. Now, certainly, if you truly wake up now, find out you do have depressed, so what are the common treatment to come by? A lot of times that you can able to get therapy, meaning that you're going to have a psych therapy or nurse therapy, whatever the therapy that you can find or you can refer to a certain doctor and psych nurse work. And the important is they will talk about your feeling, find solution treatment for you, and they will have a plan, and they might have family therapy. All those things are, part of the therapy, the therapist, and they will help you to at least get someone to talk to. It's so important. Now, certainly there's also medication and antidepressant drugs. That would be also helpful. But more importantly, you got to realize you got to manage the stress. Because stress increases your blood sugar level. Definitely with us. And then you make it your diabetic management become very difficult. So some of the tools of stress management is, for example, you exercise. You exercise, you let out those frustration, you can do meditation, and you can get enough sleep. Because not enough sleep will be very, very detrimental for your stress because you go up. Enough sleep, your stress will go up. Blood sugar goes up, and then you can become very stressful, you can be very grouchy and so forth. And then you can listen to music, soft music, and get relaxed. Read some book. Some people watch TV, but you're not getting the alcohol, smoking, all the bad habit, eating. Don't do that. Get rid of that. So that will help you definitely treat depression. But if you have severe depression, you do need doctor help. Because that is not necessarily you can handle by yourself. 嗱，當你如果真係有鬱症嘅時候，你真係醫治咧，當然啦，醫治咧就會係有啲therapist 啦，即係精神科嘅護士啊或者醫生啦，幫助你了解你自己嘅心聲啦，你嘅感受啦，同埋有咩能夠俾到你一個叫做醫治方法啦。好多時咧亦都有家庭醫治咧，即係。屋企人一齊同你嘅健康方面咧，有啲好特別嘅，因為我一個patient 有個病人，佢自己咧就已經係好有問題㗎，即係佢自己成個驚啊冇乜。最弊咧，佢屋企咧，佢啲家庭咧係俾好多 support 嘅，猛鬧嘅，係咪衰啦？你咁乜啊？咁佢更加差，所以咧就好弊。所以呢個咧就要喺方面咧，佢整咗成個 family 翻嚟嘅時候，就係家喺個。咗裏邊咧就 eliminate 嗰個屋企人咧去責怪佢，咁佢就變咗咧就個人舒服晒，因為個屋企人話你，你搞錯啊！你自己攞嚟賤嘅啫，咁佢越整講得多咧，越整咁大嘅，所以呢啲嘢咧係要真係有個 family 對幫手。當然啦 ，medication 唔緊要，食藥咧就可以幫助你 antidepressant， 即係可以，但唔係成日可以用嘅，你一定要醫治嘅。而好重要咧就係個 stress management。stress management 咧就係將你 blood sugar 係降低。如果唔係咧，你嗰啲 stress 咧 blood sugar 降低係最差嘅。咁你都係要 exercise 啦，要可能要做下一啲叫做靜坐啊，同埋聽下音樂啊，睇下書啊，睇電視啊，或者睇啲好啲嘢，就千祈唔好飲酒啊，同埋啲飽食嘢咁樣。呢啲咧就多數係最緊要嘅，即係多數嘅全部幫嘅。但好重要咧，真係要即係屋企人 support 啦，你如果有個 support， 呢個係So remember, make sure your family also support you because I have a patient family around that support you. Maybe that's your own problem and they will make you angry. They feel so guilty because, it's not their fault really. But on the end, the family blame them because it's like, you did it yourself. Nah, nah, nah. And the wife was just yelling at them, oh, wow, that was terrible. So that result, they get even more deep. So you got to get that together to fix the problem. And hopefully they will feel much better. Because happiness will get you less chances. Now, in summary, 10 to 15% of patients with diabetic might actually end up with depression. And depression is making it really difficult to help you to manage your blood sugar. Because more you depress, more stress you're going to have, more blood sugar will go up. So it also affects mental health and neuromas. It's terrible. I mean, I continue to fear, anger, stress, all kind of feeling is not good for you. So manage your stress becomes extremely important. And you have to identify symptoms. That's why I gave you the whole slide. You have to take a picture, how the symptom of depression. So you can early identify, you can seek medical help. Now the problem is make sure to prevent feeling of depression is so important to establish a solid treatment plan. Because when you have a solid treatment plan, you know what? Most likely you will have hope. Your objective, you will start measuring your solution. Is it workable, not workable? You keep working on it, you keep working on it. So then that way you must continue working on it. You have less chances to get yourself overly stressed out because you are now seeing the progress. You will start seeing the improvement. So the attitude will change. And so treatment depression usually also comes with like potential psychotherapy, with a nurse, with a doctor. So you're able to talk about your feeling, your problem, medication, and that depressive medication will be helpful. But more important, you have the stress management. Stress management is basically you have to make sure that you have exercise, you have to have meditation, book, you have to watch TV, listen to easy music. Those are the things that you have to continue to work on together so you can decrease stress, so your blood sugar and put that. Now, going to help 10%嘅糖尿病人咧係會 end up with depression。depression 咧係一個好大問題，因為如果 depression 咧就會 stress。咁當你有壓力大嘅時候咧，你嘅糖一定高，咁就好難去控制你嘅糖尿病嘅。咁變咗嚟講咧，第一樣嘢即係 manage 管理嘅壓力啦，譬如我喺度上嚟咧，所以我就邊咧有張 slide 俾你咧，就係令到你睇到啲嘢叫做 depression 嘅憂鬱症嘅症狀。好似瞓唔覺啊、homeless 啊、會想死啊啲，哇！呢個好危險，所以一定要了解。了解知道之後咧，就要揾醫生幫手，或者揾家庭幫你 support 你啦。咁同埋仲有咧，就要繼續咧係去注重點去treat 你嘅糖尿病，因為有個叫 diabetic stress 咧，即係你係有個糖尿困擾病咧，會令到你成個人就好 stress。但係你醫好糖尿病咧，呢個就manage。但係咧，仲要咧要唔好俾你去即係變咗糖尿病，即係令到你會繼續去 depress 啦。好重要咧，當你唔會 depress 點樣咧？係一定有個好嘅treatment 嘅高啊，或者你個有個 solid 嘅好實際嘅醫治目標啊。當你有目標，你睇到自己邊度進展咧，咁你個 chance depress 咧就算如果真係 depress 你轉嘅時候就第一可能會有呢個憂鬱症嘅醫治啦，呢個係可能醫生啊、護士啊呢兩個幫你啦。咁仲要咧就係食藥啦，可能呢啲 antidepressant medication 啦，咁就係壓力控制好緊要。我哋要做 exercise 啦、睇書啦、聽好啲嘅音樂啦，呢啲嘢全部咧都係幫你同一樣嘢保住你去。當你有佢就係真係降低你嘅繼續幫助你，呢個係一個好重要。當你飲咗佢之後，你 降低同埋身體整體身體好啲。Okay? So very important. Make sure doing all that. Don't forget to drink your Lowsutea. Lower your blood sugar and you continue to be better. Lower blood sugar, so overall seeing the result much better, so we can have a much better health outcome. Okay? So I hope today, sorry about a little overrun about a few minutes here. I hope today you can able to get a better feeling what is diabetic depression and know what to handle and what the scientists look at it. And you look at it, that you get able to early identify what is depression and look at the signs and symptoms so you can seek professional help early. Because if you don't treat it, it's just get worse. So I don't know if you have any questions from the group which I can help you answer. And maybe you can type it in and I can help you. 各位同學，或者你睇有咩問題咧問我啦，我哋希望係答你啦。嗱，其實咧真係咧，如果係講depression 咧係好多時係，亦都有啲好多係咪定多咗，知道有對嘅，咁嘅一個係危險嘅，因為咧如果你唔知道嘅時候咧，你喺度講嘅時候咧，可能 end up 咧 first. I want to alert you folks, depression, you don't want to get worse because when you get worse, it really becomes unreversible. You will just get worse, worse, worse. So, the important is to identify early so you can get sick of professional help. And it's not good to wait till too late and you start getting to say, I totally give up hope. And it's not working. And when that happens, it'll take a long time to actually, to change that and become deeper and deeper, and that becomes extremely difficult to. And that's the sad part. I know there's a lot of people who have that problem, and end up I talk to them for hours, half an hour before I can actually change a little. Then become stressing, like say, okay, see some light that I know I can work with, and we make goal, not big goal, tiny little goal, so they can achieve. 其實我都已經咗啦，咁佢有啲好其實咧，我係 set 好細嘅goal俾佢，即係細嘅目標俾佢嗰個望一象，先能夠令到佢係轉變咗心理上係一個好難嘅東西啊！所以 not so easy。所以記住咧，你有 depression 嘅早啲處理，冇得開心。Okay. So, are there any questions? There are no question. I appreciate all the time that you spent with me talking about also how to prevent diabetic depression. I appreciate all that help. If you are okay with that, make sure you give me a like on Facebook. Go to Facebook and give me a note there. Say, great, this is a good lecture. Give me some feedback. While you're here, you can in the chat. You can say this is good. So I can know this is something that we're doing the right things. Listen and learn. And I appreciate it. And if that's the case, I appreciate your time to participate. Now, next week is a very important time for many of you. Might be in US. For Hawaii, next week we're going to have a panel discussion with 3 doctors. One is Professor Jane Yer. We talk about diabetic eye, so we learn about what it is of diabetic eye, the tremendous collection of this. So with that, it will lead to what is diabetic, what is and how do you prevent diabetic, be a diabetic, how to prevent diabetic complication. So again, so there are 3 doctors talk about the whole program. There's going to be 3 p.m. Hong Kong and also Hong Kong and Philippine time, South Asian time. For U.S. customer, like Hawaiian customer, that will be at 9 p.m. your time. 9 p.m. We'll send you an invitation, but you gotta keep that in mind. this is going to be really good. It's extremely hard to get all these right doctors to talk about. So it will be beneficial for you. So and next week we'll make it at 9 p.m. Hawaii time on 29th, 29, 9 p.m. Hawaii time for Hong Kong, 30th at 3 p.m. Hong Kong and 3 p.m. On the 30th. Okay? So thank you very much. I'm looking forward to talk to you next week. It'll be a wonderful, exciting, very well educational. But take care. Thank you. Bye bye.